Morgan Hoffarth joins me now, President of Registered Nurses Association of Ontario. Morgan, good to have you on the program.
Thanks for having me, Angie.
I know you're going to be keeping a close eye on this press conference that's going to be happening next hour. I want to get your thoughts here on some of those measures that are being considered. Do you think it's going to be enough?
Yeah, so we're really interested to see what the Premier will announce at 11. I don't think what they're going to announce will be enough. We really are seeing an increase in hospitalization, an increase in people who are unwell, and the pending collapse of our healthcare system. Nurses are exhausted. We hear every day that hospital sector, long-term care, community sector, people aren't able to get access to service because nurses are exhausted. And with the number of people who are required to be at home on isolation because they've been exposed because of growing case counts, we won't be able to keep up.
Yeah, as you mentioned there, the exhaustion, the exposure, some of them unfortunately are now sick with COVID and not being able to come in. We know, for example, in Hamilton Health Services, they're really bursting at the seams, but also dealing with staffing shortages, asking some employees to end vacation early and to come in and work because they're severely understaffed. Talk to me more about that concern, because there have been very strong calls on the government to say something has to get done. And this was being put forward well before we were dealing with Omicron, to say if there is another surge, the system, as you say, is going to collapse.
So RNAO, along with many other nursing organizations, have talked about the repeal of Bill 124 for a long time. Nurses are exhausted. They're not coming to work, partly because they're exhausted, but partly because they feel overwhelmingly disrespected by the government for not valuing the service that we provide, our expertise. And the repeal of Bill 124, although in itself would not help to bring all the nurses back to the profession, it would make a difference to allow nurses to feel like they are valued and respected as part of the healthcare system.
Morgan, remind Canadians, if you can, what Bill 124 is.
So Bill 124 caps most public sector employees' salary increases at just 1%. There are some individuals that are exempt, so police officers, firefighters, doctors, and MPPs are exempt from Bill 124, but for the rest of public sector employees, particularly the female-dominated profession of nursing, it is a cap of 1%, set to expire in 3 months, but has been in place for a number of years. And we really have been calling more recently on the repeal of this because we're hearing from a lot of our members about how it feels so disrespectful to not be able to be compensated, to bargain for wage increases when they're doing really vital work that Ontarians need.
Yeah, absolutely essential work. In addition to this bill, repealing this bill, you talked earlier about wanting to see more that needs to be done. Clearly, what's going to be potentially enforced is not going to go far enough.
No, we know Omicron is so transmissible. We know there's so much virus, more than we even are measuring now because of the changes to testing. RNAO would like to see schools remain closed until at least January 17th, with an evaluation prior to that to make sure there is adequate ventilation, adequate access to appropriate either KN95 masks or medical masks for students and for teachers, and provided to them, not that they would have to provide themselves, and to really look at a circuit break so that we can stop the spread of COVID and give our healthcare system a chance to catch up, to really be able to provide the essential care and service to people who need it, because that's all that we're going to be able to provide, even with a circuit break in place.
And we want to make it clear to our viewers, when you were talking about the closure of schools, that was, of course, to enforce those safety measures, as you pointed out, to make sure that when they go back, everybody is safe and we can move forward with keeping kids in schools. Morgan, I know you're going to keep a close eye on this press conference. We certainly will be bringing it here live on CTV News Channel. Really appreciate you giving us your time. You and your teams all stay safe and well. We appreciate the work that you do. Morgan Hoffarth is president of Registered Nurses Association of Ontario. Thank you again, Morgan.
Thanks, Angie.
You're very welcome.